Wow, great rhythms and a brand new day, another fascinating discussion from the NTD department at the World Health Organization around the draft NTD roadmap 2021 and 2030. As we're fine-tuning and getting all the essential insights, hearing as many voices as we can along the way to ensure that the roadmap is in good stead. I'm Patricia Mira, thrilled to be moderating the discussion today that is centered around young people taking the lead. Now, a quick reminder on housekeeping guidelines. For translation, move your cursor to the bottom of your screen. On the pop-up, click on interpretation. And of course, choose your preferred language. Panelists need to click off their interpretation if they have no need for it. For the Q&A session, after each panel, we will use Slido, enter the event code, which is, I believe, NTD roadmap. A few questions will follow, of course, after that, which country you're joining us from, plus a couple of active poll questions, after which there'll be a prompt to join the session using the Q&A option on the page. We are live streaming this webinar. However, all panelists are requested not to click the YouTube link, as this will cause an echo that can interfere with the session. Last and certainly not least, we're on YouTube, Facebook, and Periscope, expecting an active presence on social media as well, using the hashtags BeatNTDs, NTD Roadmap 2030, Build Back Better, and please ensure you tag at WHO. Today, and as the saying goes, there should be nothing for the youth without the youth. And throughout this webinar preparation, young people have been taking the lead and have been involved in every step of the way and at the very core of every decision made. So thank you to youth combating NTDs, and especially Gerald Shirinda for the invaluable input and energy on this webinar, selecting panelists and adding their critical voice to, again, build back better. Now, before we go any further, there is a special message that has come in, unexpected as it was. It's a welcome thought that I feel we will all appreciate in these new days and ways of living.
Good morning, good afternoon, and good evening to everyone joining today's webinar. My young friends, although COVID-19 is rightly capturing the world's attention, we must remember that is only one health threat that many of the world's poor face every day. The pandemic threatens to disrupt life-saving services for many other urgent health challenges, including neglected tropical diseases. COVID-19 has taken so much from us, but it has also given us the opportunity to think afresh about how the world could be, how it should be. It has reminded us that health is not a luxury item. It's the foundation of development. As young leaders, you will play a decisive role in shaping the future. Today, I'm urging you to aim high and think big as you discuss the NTD roadmap for the next 10 years. Your insights, innovation, and ideas are essential for addressing the issues of poverty and achieving our shared vision of an NTD-free generation. Thank you, and I wish you all a very fruitful discussion.
A huge thank you to WHO's Director General, sparing a moment in what is a critical time for world health to share his thoughts and words with us today. He talks about innovation, access, equity of health services, thinking afresh about our concerns, shaping futures, thinking big and sharing visions, topics that we will certainly feature in our conversations today, as well as voices from the field that will give us some insight and hopefully spur us further in the work yet ahead. Speaking of motivation, I caught up with one young woman named Mimi Mars, who has a growing and an incredibly powerful media platform. Given that we'll be talking about youth engagement in the fight to beat NTDs, I asked her to talk about what ways music, art, youth culture play in making young people advocate for issues that affect marginalized communities, especially in health. Here's what she responded.
Music has the power to move us and change us, and it has the ability to bring messages to people in so many different ways. The combination of the right lyrics and rhythm and band or singer or artist, all of that can merge and make something very big that can move a big crowd or move people, and it just brings emotion and knowledge in different ways. And I think music makes the perfect partner for social change. And music also connects us a lot, whether we know the language or we don't know the language, but there's something about it that just connects people together, and that's why they call it a universal language. And for social messages to take root, they must be accepted by large numbers of people, and individuals are more likely to accept these messages if their peers do so. So music is the great way for young people to express themselves and bring their voice to issues which affect them and impact their lives, and spreading the issues and bringing about change. So I believe that music is the best or the greatest way to make sure that messages are passed through, whether you're old or young or, in the middle, teenager. Music always finds the way to give a message to a person.
Hello, my name is Mimi Mars, and I'd love for us to sing this song together, if you know it, or if you don't. Karibu. Kutokucha nipo naye, kwenye shida na raha nipo naye, sithubutu hata kuachana naye, akinuna mimi nacheka naye, natamani hata hii dunia ingekuwa yangu, nikupe wewe, na kama wapo wengi wasiotaka mimi nikupende, macho kodo, macho kodo, macho kodo, macho kodo. Hey, come on now, let's dance. Na nishawambia umenishika tena umenishika swaa, hata ukinigusaga na furahi, unanijulia sita kwa sita sasa, mali amenifika hapa, safari nafika Ghana, ndo maana natamani hata hii dunia ingekuwa yangu, nikupe wewe, kama wapo wengi wasiotaka mimi nikupende, macho kodo, macho kodo, hey, macho kodo, macho kodo. Sikwachi, yeah, sikwachi, hey, nakupenda bala, na vile ulivyo, nakupenda bala, na vile ulivyo. Sing, nakupenda bala, na vile ulivyo, nakupenda bala, na hivyo ulivyo, nakupenda bala, na hivyo ulivyo. Hey, nakupenda bala, na hivyo ulivyo. Acha wakutole macho kodo, mi bado nakupenda.
Love it, love it, love it. The message is in the music. I totally agree with Mimi Mars. Thank you so much for that, and wishing her all the very best. And looking forward to hearing more about how her media platform will shed light on NTDs in the future. And that's the point, isn't it? Today's youth are a different kettle of fish to yesteryear. Their ability to conceive, develop, communicate, organize, and produce whatever lies in their imagination sets them apart from previous generations. Tapping into this wealth of drive, creativity, and perspective, ensuring that we understand what they're saying, needing, doing, vibing with, and what they get, and that they get the support that they need, can only add strength to this movement to ensure that the roadmap can deliver on its promise to the communities that need it the most. So a warm welcome to you all, and let's get started. On our first panel, we'll explore how youth can influence change in the face of the numerous public health and equity challenges for NTDs and for the draft roadmap. And I encourage all panelists to speak on their experiences so that we can really get a well-rounded perspective and make this as conversational as possible in this next 18 minutes. On the panel for this conversation, we have Dr. Nene Salah from Youth Combating NTD's Advisory Board, Amazing Grace Makusha from Global Shapers Community Harare Hub, Fatima El Basri Abul Ghassim Mohammed, Medical Students International Network in the Sudan, and Dam Ndiaye, Chair to the No to NTD's Civil Society Network. Welcome. And having read your bios in preparation for this webinar, I saw that, Nene, you're heavily involved in research. Amazing Grace is an accountant by day. Fatima, a medical student, and Dam works around child marriage and reproductive rights. Each of you with an interesting lens to shine in with regarding NTDs. But it would be interesting to know how you all got involved in the NTD space. Who'd like to go first? Go on, Fatima.
Okay. Thank you so much, Patricia, for the warm welcoming. And I'm really glad to be part of this webinar today. So how I got involved in NTDs. So I come from a developing country, which is Sudan. So in Sudan, we are having 16 neglected tropical diseases out of the 20 NTDs which are recognized by WHO. And neglected tropical diseases are with high burden, especially when it comes to morbidity. As a medical student, I observed, and during my clinical rotations, I used to meet, and I still meeting many patients who are suffering from neglected tropical diseases. For example, some patients have mycetoma, and they are suffering from some consequences and morbidity, disability due to the amputations, which can happen due to the mycetoma. Some patients have trachoma, onchocerciasis, and they got blind. So this fact affects me a lot. And I can see also that many children are affected by neglected tropical diseases. For example, the visceral leishmaniasis, schistosomiasis. And this is a very sad thing to see vulnerable groups like children and women to be infected with NTDs. Yeah. So how I got introduced to NTDs, I was a member in my association, Medicine Sudan, and we have started a project to start making a new initiative led by our organization. So we've started to plan to write a proposal for our project, which is the Neglected Tropical Diseases Project, in the past year. And I was reading about the topic a lot, and I was involving in my community a lot. So I started to develop special interest toward neglected tropical diseases. And right now, I'm the Neglected Tropical Diseases Project Coordinator in Medicine Sudan. And hopefully we are going to join the global movement and the global cycle to fight neglected tropical diseases and achieve our vision until 2030.
Fantastic, fantastic. Amazing Grace, an accountant. How did you get here?
Thanks, Patricia. Like you rightly say, I'm not a health practitioner. I'm an accountant by profession. And I only came to know about NTDs 2 years ago after joining the Global Shapers Harare Hub. So at that time, the Harare Hub was doing some work with a local NGO to encourage citizens to attend mass drug administrations. So once I plugged into the hub and came to know more about NTDs and how they affect 70% of the Zimbabwean population and how Zimbabwe is burdened by 4 of the major NTDs, I just felt compelled as a citizen and as a female to do some work around the space. So Zimbabwe is heavily burdened by schistosomiasis as well. And after learning how, on the back of the HIV pandemic and the ravages that it had taken across sub-Saharan Africa, and in Zimbabwe in particular, where I come from, and how having an NTD like schistosomiasis will actually increase the risk of women getting HIV, I decided to lend my voice to the space. There's a quote by Albert Einstein that I live by, and it reads, we have to do the best we can. This is our sacred moral responsibility. So this is how I'm living my life and using my voice to advocate in the space and make a difference.
Powerful.
Thanks, Patricia.
Powerful, powerful. Nene, let's hear from you. How did you get into this?
So, I got into infectious disease very, very early on in my career. So straight from high school, I went to work at the Medical Research Council in the Gambia.
Okay.
At the time, I wanted to be a doctor. I didn't really know what research was. It was a space in my mind that was filled with old gray-haired men. So having gone there, I realized the scope of the burden on public health and the economy that infectious diseases, particularly in such a small developing country, and particularly with poorer communities and young people being affected. So those were really where my motivations came from. And with further training, I developed my career in science, and I'm now working at a UCL in the interface between computer science and health. But really, I had a great opportunity to come back to more of my infectious disease developing country roots through the opportunity of the Youth Combating NTDs program. I saw that was a really, really great platform to be involved and help them set their agenda, to be able to stimulate and harness the energy that youth have, and really bring fresh perspectives on combating NTDs and achieving an NTD-free generation.
Great, great, great. Dan, was it something similar for you? Were you already in the space, or was it all about children and child marriage? That's a big topic there, Dan.
Bonjour tout le monde.
Hi.
J'essaye un peu d'activer la traduction, mais ça ne marche pas. J'ai toujours pas la version française, malheureusement.
Hello.
Hello, bonjour.
Yeah, sorry, I was trying to get my translation right. You see, this is the problem with us old folks. Sometimes we just don't know how to speak in so many different languages. But thank you so much for your answer then. Dan, again, to all of you, so from your particular vantage point, having now actively worked within the community, what are you currently doing to fight these diseases? So, for example, Amazing Grace, as part of the Global Shapers community with hubs in 171 countries, that's absolutely incredible reach. So your networking game must be very strong. Do you get to utilize this resource?
Yes, I do. But though, to be fair, the hubs work in cities. So our work is mostly channeled towards the Harare region. Okay. So our work is three-pronged, where we are focusing on training. So most recently, at the recently inaugurated World NTDs Day, we actually won a grant and we were able to host a half-day seminar. We brought in various stakeholders. We brought in the private sector. We brought in Ministry of Health professionals. We brought in school kids, and we're actually able to train them on NTDs and the work that's currently being done. The other thing that we're trying to do is advocacy as well. So for the past 3 years, we've attended the Victoria Falls Marathon, which is the largest marathon in Zimbabwe. So over a 2-day weekend, we have 5,000 people coming in, and we've got 2 members of the hub that actually then take part in the marathon every year, and we just rotate. And at the marathon, we'll actually have an exhibition stand where we highlight what NTDs are. We issue out pamphlets. We have spot quizzes, and people win branded material. And the other thing that we're doing is we're building partnerships. So we have NGOs in Harare that are working in the fight against NTDs. So we've been able to partner with them. And right now we're working on being a partner in the sense that when they're having mass drug administrations, they can actually call on the Harare Hub, where we go in, say, a week before to schools in the targeted regions, and we carry out blitz exercises, and we train the kids on NTDs, and we encourage them on water and safe, sanitation practices. So that's the work we're currently doing in Harare.
Yeah, brilliant, brilliant, brilliant. Nene, what's happening with you? What's happening on your end?
So, I mean, mine is kind of twofold. So one, being involved in the youth combating NTDs. I mean, we are the first global movement to fight, to basically mobilize and support youth to fight NTDs. I mean, which is incredibly important because, I mean, our mission really is not only to engage the youth, but empower them and support them so that they can amplify their voices. I mean, we have so much energy. We bring fresh perspectives to the table. And on the second arm of that, I'm a research scientist. I realize that my role as a scientist is even bigger than I am because not only am I a woman, I'm a Black woman. So I know I serve as a conduit for every female and every African child. So just having me up there sort of will I guess stimulate other young people to say, who want to pursue and excel in STEM or education or anything to do with I guess fighting disease. I can do it too. I can, there is a path that I can follow. Every journey is not linear, but I can get there. And it's very, very important. Representation matters. So having someone like me on, in the room, on the table, like lending my voice and supporting others goes a tremendously long way and is more sustainable.
Yep, representation and mentorship. Yeah, all for that. Fatima, sorry, I keep going to Dam last, but it's not a thing. But Fatima, let's hear from you.
Okay, so right now, as the youth in Madsen, Sudan, in neglected tropical diseases project, the main action which we are taking right now is to work on the advocacy. And as you know, advocacy as a process is not. It has many components, starting from doing proper researches to assess the current situation and collect the data about our situation in Sudan. And then we aim to capacitate the medical students because the medical students are the main manpower which we are having in Madsen, Sudan for sure. And we are making sure that they are well capacitated in form of knowledge and skills about neglected tropical diseases which are found in Sudan region. So Sudan is a large country. We have many regions within the country, and the NTDs which are found in the different regions, they are not the same. So we aim to capacitate the medical students to take actions in the regions. Secondly, we aim also to increase the awareness among the general community so they can know much more better about the NTDs in the regions, and also to mobilize them to take the initiative to develop their own communities. And for sure, doing research to bridge the great research gap in neglected tropical diseases is a very important thing. And it will help us later on to formulate our own policies, to make evidence-based policies, so we can influence the decision makers in our country and make stronger collaborations with them. This is briefly what we do.
Yeah. So awareness campaigns, we've heard, representation, mentorship, advocacy, skills, knowledge. Dan, what are you working on?
So I, as Fatima, you mean?
Sorry, I'm moving over to Dan. Thanks, Fatima.
Okay, you're welcome.
Enthusiasm is always encouraged, though. But yeah, Dan.
Oui, alors merci beaucoup. Donc, je pense que je vais m'y lancer, même si la traduction fait un peu défaut. Donc, je pense que je vais commencer par me présenter. Je m'appelle Dam Ndiaye. Je suis coordonnateur de l'Alliance nationale des jeunes pour la santé de la reproduction et la planification familiale du Sénégal, qui est une organisation de jeunes qui est dirigée également aussi par des jeunes. Alors, nous intervenons principalement sur des questions de développement durable, notamment sur tout ce qui est question de santé et du bien-être. Alors, et notre engagement sur les questions de maladies tropicales négligées a démarré, en tout cas, durant l'année 2019, grâce à notre collaboration avec Speak Up Africa, justement pour mettre en œuvre une campagne dénommée Non aux maladies tropicales négligées. Et pourquoi le sens de notre engagement? Parce qu'on s'est dit en tant qu'organisation de jeunes, il fallait en tout cas apporter notre contribution par rapport à des problématiques de santé publique justement qui touchent les adolescents et jeunes. Et c'est pourquoi nous avons développé en tout cas des séries d'activités de plaidoyer pour la mobilisation des parlementaires et des décideurs politiques. Parce que justement, nous pensons que pour régler les problématiques des maladies tropicales négligées, il fallait justement amener les collectivités territoriales, en tout cas, à dégager des budgets pour accompagner les programmes nationaux. C'est pourquoi nous avons élaboré toute une stratégie de plaidoyer à l'endroit des décideurs politiques pour justement développer des actions qui vont nous permettre de mobiliser des financements endogènes. Parce que c'est l'un des éléments aujourd'hui qui...
Oh, I think we may have lost Dan. Okay, Dan, you there with us? I think you may be having some connection problems. Let's continue talking about gaps and challenges, and of course we can catch up with Dan after he gets to reconnect. Let's hear some clear thoughts on your clear thoughts on this, how these gaps and challenges can be addressed, or any gaps and challenges that can be addressed that you have experienced in your work.
I can go.
Yep.
Yeah, so I mean, coming from a country like the Gambia, I think we've been trying to make lots of progress, and the fact that we have a research institute in the country has kind of helped drive some of our initiatives. However, we have like a lot of gaps, particularly with regards to data, with data being outdated or incomplete or just not there. So while it seems as if we have been making strides in the right direction, and we have, I guess, on quote unquote, on track to eliminate NTDs like trachoma, the truth is we don't know. And absence of evidence is not evidence of absence, right? So we need to like be able to have proper surveillance strategies to be able to make progress there. And with regards to youth involvement, I think it's critical to be able to get to make progress on some of these initiatives, to be able to communicate them better from a global to a local level. So I think that's where youth involvement has a huge role to play in advocacy. And also, I think it's very important to have cross-generational and interdisciplinary partnerships to be able to catalyze action, to truly be able to have sustainable and transformative actions.
Okay, yeah, you're right. Fatima, what would you add to that?
Okay, so from my own experience, the problems or the gaps which we are facing, first of all, is lack of awareness and lack of knowledge, either among the medical students themselves or among the community. And Patricia, the problem is when the people do not know the scope of the problem and the rights, yes. They do not know that they need to speak up. So no solutions and no decisions will be taken. So this is the first problem. There is huge lack of awareness and lack of knowledge regarding neglected tropical diseases. The second gap that we lack the multi-sectoral collaborations, because if we want to solve a problem like neglected tropical diseases, we need to work on multiple aspects. For example, the water sanitation and hygiene, and also the vector control. education, we need to improve the curriculums. The zoonotic disease, so we need to work with the Ministry of Animal Resources to vaccinate the animals, etc., etc. So the multi-sectoral collaboration is one of the things that we lack, and the stakeholders, they do not come to a specific point to agree on it regarding neglected tropical diseases. And also students should be involved in the middle of this, in the middle of the multi-sectoral collaborations. The third point, which is a very important thing, is the problem in our health system in Sudan. For example, as you all know that the primary healthcare units are very essential things, especially in the rural areas, because people do not find the health services that they need. So we have problems regarding the primary healthcare centers, availability, distribution, and even the logistics within them, the treatment and the manpower. So this is one of the problems that we are having, in addition to the health financing problems. So there is no fund which is going or allocated toward fighting neglected tropical diseases. Our country depends mainly on the fund, which comes from the outside external fund, but we need also to set some strategies regarding health financing, the structure of the health system, and for sure multi-sectoral collaborations.
Wow, wow, yes, that's a lot there. Amazing Grace, what would you add from your perspective?
Thanks, Patricia. With the work that we do here in the Harare Hub, the challenges that we face so far and the gaps are to do with adequate training material and relevant training material. So I suppose it's also building on the point that Nina made, where we just can't access the accurate data, and more so training toolkits that we can actually take to the community, and bearing in mind that we're engaging with kids in primary schools and high school students as well. So we would want like a repository of information. So if we're looking at organizations like Youth Combating NTDs, if they can fill that gap where they actually have this material available that we can then tailor to our specific needs and just draw down on demand when we go into the community to train individuals. Another challenge that we're facing is just the lack of support and network among youth globally that are fighting NTDs. So, this platform has been brilliant. I got to meet Fatima, I got to meet Nene and Dam, other youth that I would never have met if not for this platform. So, going forward, it would be good if an annual sort of like a conversation like this occurs whether we meet in person or virtually, and we can just keep each other accountable in terms of the strides that we're making in making sure that we meet the 2030 deadline. And the third thing will definitely be funding. The work that we do, it's on a volunteer basis, and we can only do so much. So when we then actually do projects, it's because we will have a benefactor that comes in with a once-off project, or we have to enter a competition and win some money. So if we can have organizations like the WHO, for example, channeling funds and setting aside funds for NTDs and the work that's being done specifically by youth in various countries. So even if those funds are then channeled through organizations like Youth Combating NTDs, and maybe they can then work with partner organizations in various countries to disseminate the funds and then actually fund the activities that we are doing, would actually be able to do a lot more because we're currently incapacitated. So those are the challenges that we are facing and the solutions.
Yeah, great. Dam, do we still have you with us?
Alors, merci beaucoup. Je pense que en termes de gap et de challenges que nous avons rencontrés dans le cadre de ce travail, justement, surtout dans ce contexte de pandémie, c'est qu'aujourd'hui, il est un peu difficile, justement, de mobiliser les décideurs politiques parce que tout simplement, en tout cas, le contexte sanitaire ne permet pas qu'on puisse les rassembler, mais également aussi qu'on puisse davantage renforcer la communauté.
Oh, we're losing Dam again. Oh, we're losing Dam again. Okay, hopefully we can get him back.
C'est-à-dire l'utilisation de tout ce qui est plateforme interactive, les réseaux sociaux aujourd'hui pour communiquer sur justement les maladies tropicales négligées, mais également aussi tenir des réunions de plaidoyer avec les parlementaires. Mais l'autre action également aussi qui me semble assez importante dans notre travail au Sénégal, c'est que nous nous sommes organisés aujourd'hui en coalition sous-régionale. Et dans cette coalition-là, il y a des organisations, en tout cas qui sont de la Guinée, du Niger et du Sénégal. qui ont en tout cas élaboré un plan d'action justement pour intervenir sur ces questions de maladies tropicales négligées. Et je pense qu'en termes également aussi de challenge, c'est de renforcer cette dynamique régionale-là qui existe déjà au niveau de l'Afrique de l'Ouest, mais réfléchir également sur comment rendre en tout cas ces initiatives à l'échelle régionale. Parce que je pense que c'est des approches qui peuvent être utiles justement pour la population de manière générale du continent africain.
Okay, thank you so much, Dan. A few questions. Let's turn to a couple of questions that we're getting in from our audience. How do you involve traditional healers in tackling NTDs in your country? You need to work together. To all speakers. Oh, Amazing Grace, I saw that. It was like, ooh, we're going deep here. Who would like to go for that? Fatima?
Okay, so I can go for this. So in the developing countries, we are having many problems when it comes to neglected tropical diseases, or actually the concept of disease itself. People tend to go to the traditional healers instead of going to the specific primary healthcare unit or to the doctor as general. So the most important thing that we need to do is to increase the awareness. We need to educate the people, especially in the rural areas, the remote areas, about how they can behave in a good way and how they can have good actions and correct actions to cure themselves and their beloved one from the neglected tropical diseases. And actually, some legislations and rules must be put by the government that, for example, the specific practice without a license is not a legal thing, etc., etc. So we can do this by advocating. Advocacy is the main key to solve all the problems when it comes to the community, especially when we have limited resources in the developing country. So increasing the awareness itself is the major key.
Yeah.
Okay, I hope that you heard me.
I can. Okay. We can hear you. We can hear you. It needs to be said, I was hoping that I was going to get some translation there for Dam and for the people who cannot speak French or do not understand French. And unfortunately, we can't get it working for some reason on the Zoom platform. So apologies from the NTD team here at WHO. Okay, would somebody like to tackle that question? And Fatima, I was just thinking as you were speaking, perhaps it was got something to do with not being able to afford going to a medical clinic. Maybe that kind of factors in. And of course, belief systems. How do we tackle things like that? Nene, Amazing Grace, if you could, or Dan, if you could jump in on this, it's a big one. What are your thoughts?
I mean, it's very contentious and very tricky whenever you try to tackle that. And it's important to have these conversations and take their belief systems into account and find a very, I guess, I don't know, diplomatic might be the word to use to be able to make them feel involved and part of the process as well, because it's very easy for people to feel like it's either for or against, which, I mean, it's like you're trying to change an entire mindset.
That's
so
right.
Like the reason why people would go to traditional healers is because, generations of deep-rooted beliefs. And that is, and people just feeling that, well, this is definitely going to work for me because it worked for,
So, yeah.
So I think we do need to have that dialogue with them. I mean, it's when you're going particularly to more like rural areas, I think engaging like, the leader of the village or the leader of the town or whatever, and getting them involved in the conversation to speak to their community works a lot better in my experience.
Yeah. Local chiefs, you're so right. We've gone way over time, and because the conversations and what you're all saying is so rich. So I'd like to say thank you to you all. Nene, Amazing Grace, Fatima, Dam as well, who you seem to have lost, unfortunately. As we digest some of the points raised with our first panel, it may prove useful to know what people outside the NTD community think, whether they think anything at all about the health concerns that so many communities suffer. So let's take a moment to get a sense of what word on the street is. Let's listen in.
To me, NTDs are a group of forgotten diseases that impact the world's poorest, most forgotten people. tackling NTDs would mean equality, development, and health justice.
Eliminating NTDs is a step towards achieving the universal health coverage.
Ending NTDs means addressing the social, economic, and health disparities that continue to exist and sustain the epidemic today.
I don't know about tropical diseases.
To me, NTDs are those diseases where we really need to reprioritise our research and funding into if we want the world to be on much more of a level playing field in terms of global health.
To me means the diseases that the community and the health ministries, especially in tropics, have forgotten to care about, but they are killing vast majority of people.
NTDs to me means unacceptable inequalities.
Neglected tropical diseases are diseases of poverty and inequality.
Interesting to hear some of the responses on that collage of voices. But a number are aware is excellent, touching on health justice, the word forgotten. The big one, universal health coverage, refocused funding.
Go back to the...
With one completely unaware.
No, I can hear only... tell them to unmute.
Somebody muted me, but I'm back on anyway. But I would like to add my voice to this because NTDs were only recently on my radar. And that's because I did some work on tuberculosis, on a tuberculosis conference. And that goes for a number of people that I know who needed examples of what NTDs are, after which, of course, there was a light bulb moment. So I'd chime in for some more media savvy awareness campaigns as part of the strategy going forward. But turning to the organizations that are working with young engagers now, let's have a chat around how best to support these eager minds. So with me, Mr. Mohammed Abdul Khair, the Deputy Director of Scouts in Bangladesh, Toko Elfik Pule, Director of Uniting to Combat NTDs, Alison Krentel, the Chair of the Canadian Network for Neglected Tropical Diseases. Now, given our focus today, you're already acting on the roadmap's need for an intergenerational collaboration, having established commonalities and seeking to build on more. So your being here will enrich this discussion for the young and for the organizations seeking to build effective bridges of partnership. So let's ensure we get the most out of each one of you, and feel free to speak in and add to what's being said. We can begin by talking about the value of engaging and working with the younger generation. Surely this seems like the obvious thing to do. Now, in terms of the draft roadmap itself and the rather demanding targets that have been set, having the young, the new bloods, as I like to call them, bringing with them different, perhaps fresher perspectives on the way they tackle issues and their resourcefulness will make it more achievable, wouldn't it? Toko, you're smiling.
I am. Absolutely. I just think we've just had some amazing speakers. I'm sure everyone who's been listening to these young people that have spoken this morning must be totally bowled over by just hearing the energy, the enthusiasm, and just what young people have to offer in NTDs. I particularly am really, really excited to have this energy that we've heard about today. I just want to reflect on what Nene said. Nene said representation matters. When you consider that young people, in 2019, I think young people were estimated to make up 16% of the global population. 1.2 billion people in 2019 were estimated to be in the 15 to 24-year age bracket. So that's a huge proportion of people. We cannot afford to leave them behind. So their voice matters. What they have to say really matters. So I'm really excited and want to take this opportunity to thank Dr. Mwele and the WHO team for creating this space during the NTD webinars to make sure that we can focus on the contribution of young people. And I think if anybody was ever in any doubt about how and why the youth voice matters, Dr. Tedros taking his time out from the COVID-19 demands to really lend his voice to young people really shows why this is such an important topic. So if any young person out there is ever in any doubt about why they matter, I hope today demonstrates that actually they have an important contribution to make in NTDs.
That's so right. That's so right. Khair, are you there? What would you say about this?
Yes, I am here, but I cannot show my video.
That's all right. We can hear you loud and clear.
Actually, the young people can protect the NTDs.
They certainly can, yeah.
Because they can transmitted the message to a peer educator, their parents, their community, and all communities, parents, always here by the young.
Mm-hmm.
That's why this is the most important, that the young can fulfill the target 2030.
Alison, I'm sure you'd echo this.
Yes, actually, I was actually thinking something similar. Wearing my researcher's hat, one of the things that I see is a lot of the times the messages and the campaigns that we develop to ensure that we have good reach of our programs don't always consider the youth and young people. And they're such strong communicators and they have such great energy. And we really need to think more in our programs of how we can really leverage these wonderful voices we're hearing this morning, and also in so many parts of the world where there are student groups and youth associations that we could really use to help us spread the message about NTDs. So I would echo that. We need to use our young people as better ambassadors for our programs, and both for the MDA and also for our disease management programs.
Yeah. Thank you, Alison. And just before we go any further with more questions, I just wanted to let you know that the interpretation is now working. You can switch to French or Spanish. Just select right down at the bottom of the screen for your preferred language. Okay, back to the questions. I'd like each of you to speak to some of your experiences working with younger generation. I'd like you to pepper it with anecdotes as well, how integral the youth were and how without them you could not have turned things around as effectively. Why the experience worked for you? Kaya, I know there was some great work done around dengue last year. Perhaps you could expound on that.
Yes. Can I share the screen? Can I use the screen share?
If you possibly could. I'm not sure. There we go. You're on.
We are Bangladesh Scouts. You know that Bangladesh Scouts is the largest youth movement all over the world.
Yeah.
Out of 171 countries, we are the 5th in number of scouting.
Okay, Kaya, if I could just stop you there briefly. If you could just tell us about what happened, how it worked for you.
Yes. Sorry.
Alison, would you like to start us off and then we can get back to Kaya? I think he seems to be having some connection.
Bangladesh Scouts has been working to prevent dengue from 2008 due to severe outbreak last year. Our Community Development and Health Division work in a huge platform.
Yes.
First, we arrange a meeting at the decision-making level with the preparation of the head of institution, with the participation of head of institutions all over the Dhaka.
Mm-hmm.
Then we build up awareness among the teachers and students by the head of institution with the supervision of scouts and leaders. After that, we motivate the parents by the students. Then we campaign door to door.
It was like last year, households, wasn't it?
Door to door campaign is there is an breathable area, the water, staying in water.
Yeah.
About cleanliness. Last year, Bangladesh Scouts went 4 million, more than 4 million.
Yes, 4 million households.
Yes, and we found the breeding zone of Aedes, and we motivate the people. We should to clean it. We should be clean, and we have to avoid the.
Okay. Alison, what could you add about your experiences? And anecdotes. We want to get to
so in last year, we thought we wanted to engage Canadian youth, students and young professionals to be more engaged in NTDs. And so we had a video contest and we put it out with the question, why should Canadians care about NTDs? And we asked for a 3-minute video and we got an incredible response. The committee, we were bowled over by the quality of the videos and the messages that came. We didn't give any more direction other than why should Canadians care? And it became a wonderful resource for us. We met some wonderful people who we could engage, and we were able to identify a youth ambassador, Priscilla Pangan, who I believe is going to be speaking in a video recording later. And she did a wonderful job and accompanied us to Women Deliver, which gave her a wonderful exposure to other youth advocates from all over the world. So it was a great experience.
Okay, Toko, some experiences from you.
So for me, first of all, I'm a mother of a 22-year-old daughter. And those who know me, I'm a Nguni woman. My mom was a Nguni woman. So I was brought up by a tough Nguni woman who brought us up quite differently. And what mom said, this is how it goes, this is how it goes.
No.
So basically, I learned that my parenting skills being brought up by a Nguni woman looked very different to what 22-year-olds require now. So I have really been trained well about the need to listen to young people. The way that I think things are done, my daughter basically, I'll say to her, so she'll ask me really tough questions and I have to answer them. So why does this matter, mom? But do you know about this too? So I've learned really, really how to listen to young people. And this came in for us at Uniting when we're starting to think about how do we engage with young people. And Youth Combating NTDs, and Gerald particularly, has been amazing. He mobilized a number of young people from all over. We met in Rwanda earlier this year and we had a roundtable conversation. And what was very clear for us is that you don't turn up with a piece of paper and say, we want 1, 2, 3 done. Can you make it so? So this is such an important thing, putting your problem on the table and really allowing the energy, the creativity and the ideas of young people to be part of the solution rather than just be an implementation mechanism. So what we have really learned is that a dial the youth way of advocacy does not work. That a youth isn't just somebody you dial up and you show up and once they've done, once you're done with them, you just put them out.
You put them to the side.
High listening, engagement, and really if you open your ears and your eyes to the energy and the creativity, you will go that much further.
Yes.
So our experience has been nothing but exceptional, exciting, and we really are so excited about what's in store.
Okay, great. What recommendations, would you pose, would you pose to different stakeholders attending this webinar on how best to engage this dynamic force, in their work?
So first of all, to be really intentional about youth engagement, and really, first of all, I talked about the statistics and how many people make up the youth population. And I was actually looking up some names here that I want to share with some of our participants today and see whether they actually ring a bell to any of them. So for example, if I mention the name Emma Theophilus, will that mean anything to our listeners? Or Amina Longo, or Bogolo Kenewendo, or Faith Kiza? So these are names on our African continent. Emma Theophilus is age 23. She is Namibia's youngest minister. She's the Minister of Information and Communication in Namibia. She is 23. Amina Longo, she is 29. She's recently appointed as the Minister of Gender for Chad. Bogolo is 30. She's the Minister of Investment, Trade and Industry in Botswana. And if you look at her CV before her appointment, it's amazing.
Yeah, I would imagine.
It just made me wonder what I was doing with my life.
Likewise.
A 30-year-old who's just doing so much.
Yeah.
And then for Faith Keza from Rwanda, who is she's the CEO of Irembo and leading the digital transformation of government services in Rwanda. These are amazing young people. So my encouragement to the NTD community, let's not think about young people as messengers only, but let's think about young people as leaders. Let's not think about young people as leaders of tomorrow. Let's think about young people as leaders for today. And really be intentional about how we engage with them and be strategic about their role. And if there are opportunities to work with young people, let's take them on board. But actually, my encouragement is that let's take a more tactical and strategic engagement, listen to young people, work with them, and I think we'll go very far.
Alison?
Yeah. So I would echo, I think Toko said that beautifully, and I would completely agree with her. I would just add also something that I've learned and working with students and young professionals that come and work on our team is I get pushed in lots of ways that I didn't expect to be pushed, and certainly in the technical arena, I get pushed in new and learn new things all the time, and also ways to approach a question, ways to approach a response, and it's a great learning experience. It pushes me into new horizons, and I would encourage us also, I think, to be really open to explore things in a new way. And we're certainly seeing a real human rights, social justice focus that's coming, really being pushed by younger people. And I think that's something we really need to pay attention to. It fits very well within the WHO NTD roadmap. And I think, as Toko said, we can really learn and use the youth and young professionals to really guide us as we explore these issues and ensure that we have a more rights-based approach to NTDs moving towards 2030.
Brilliant, brilliant. We've got so many questions kind of just flooding in, and it seems that we're not really getting a proper connection from Kyer. So I'll just move to questions, and hopefully he can jump in as well when he hears something that he'd like to respond to. What materials, tools, information can the NTD NGO community develop and provide to support youth champions in NTD civic engagement?
That's a really, really good question. And it highlights a need which has been identified. So one of the things that we're talking about thoughtful engagement with young people, when you've got ambassadors and champions that are keen to do something, we need to make sure that they are resourced and they have the tools to be able to act. And there is a big gap. We have been contacted over the last few months about young people saying, I want to go out, I want to do training. And I think Amazing Grace also mentioned it in Harare during the Harare Hub that they organized training. So we really would love to work with the NNN, and I think there's an opportunity for NNN to help in providing training materials that can be used by these amazing champions. And here is where the opportunity is. Working through the structure of Youth Combating NTDs will also help in identifying what works for young people. How do we tailor the information and the materials that we have that may potentially be geared towards technical people, academics? How do you really make it resonate with young people? So there is definitely a gap, and we need this repository of information and a database that champions can access to be able to conduct training. So great question coming in from the NGOs.
Yeah. How can other organizations involved in NTD elimination work with youth groups? We have tools and resources to assist and need to work together. How can other organizations involved in NTD elimination work with youth groups? Well, that question didn't come through very clearly. I believe medical jargon is an obstacle in achieving full awareness to NTDs among youths. How can we help this situation along, basically? Alison, what do you think?
This is a great question, and something I really think a lot about, that we need to be simple. We need to be better communicators. Unfortunately, the names of NTDs are a mouthful, and just being able to pronounce them correctly is even a challenge for us that work in the field. So, how do we expect people who don't have the same background? So I think there are some challenges inherently in NTDs, but I think we do need to make sure that our messages are simple. We also have to think outside of just strictly health messages. We need to think about, the development and empowerment and reduction of poverty. We need to think beyond just reducing NTDs will bring better health. It has huge impacts for people that go beyond their health. And so I think thinking more widely about our messages and how we communicate about the importance of NTDs is really important.
Yeah, creating links. You're right. Thank you all. We've got to be rushing forward. Again, it's a question of time. Thank you so much. And people talk about, early adopters, especially when mentoring the youth. But I think, you guys, Toko, Kai, Alison, I think your organizations have certainly gone a long way in setting a trend for other organizations to follow. So thank you to you all. Young voices picking up the mantle across the world, advocating for change on health matters, and not just in these COVID times. A few words from Priscilla Pangan, who, of course, Alison has just mentioned, coming on now.
Hi, everyone. My name is Priscilla, and I'm joining you today from Ottawa, Canada. I served as the 2019 Youth Ambassador for the Canadian Network for Neglected Tropical Diseases. I learned last year that NTD control truly is the missing link for a lot of health and rights issues, from closing gender gaps in health and beyond, to overcoming barriers to education, and mitigating the health effects of climate change. In applying for the role, I was asked to answer the question, why should Canadians, and specifically young people, care about NTDs? I think that now, more than ever, the Canadian public are aware that health issues and challenges transcend borders. And we know from the global climate strikes last fall and recent protests against systemic racism in the US and here in Canada too, that young people are on the front lines of these movements. Young people do care, and they're the ones leading the calls for transformative change. Our generation is critical to achieving the targets set out in the 2030 roadmap for NTDs. I join young people globally in the ask that we not only get a seat at the table, but also called into the conversation and have our voices heard.
Fantastic. So with people getting a better understanding of how health matters affect us all, let's get back to the discussion at hand. Priscilla talked of NTDs being the missing link to a host of health rights issues, advocacy and activism, making sure your voices are heard in the corridors of those that make the life-impacting decisions, galvanizing the support you need to be the change the world needs. Now, our next conversation aims to shed light on this, strategizing for the future. What needs to be done next? Joining me now, Jonna Claire Turalde, who's part of the Youth Combating NTDs Advisory Board, Tony Muzira, Chair of the Pan-African Movement Youth for Universal Health, and Kwabena Opoku, Leadership Development at Water Youth Network. Once again, you're all welcome to add comments made by fellow panelists as we tackle this topic. Delivering dividends, better and enhanced lifelong health and better health for future generations, making healthcare affordable, increased accessibility and promotion of better services. These are not just buzzwords, but a necessity when looking at the draft roadmap. The question is, do you think there is scope for youth development? Jonah, coming from a gender rights background, what do you see?
Hi, thank you, Patricia. So in the roadmap of NTDs, we saw that young people's participation is actually mentioned to be part of the country co-ownership on the local NTD program. So it's more important in the roadmap that young people are locally participating, but actually, as mentioned by Thoko a while ago, young people are actually globally participating and globally connected and involved. So last February, in Tanzania, we signed the Dar es Salaam Youth Declaration on neglected tropical diseases, wherein 150 young people are already involved in this in this owning the NTD advocacy. But the question is, how do we translate this into action? And with that, with translating into action, we need to understand that young people are not homogeneous or monolithic group of people. For example, we in the youth combating NTDs, we're diverse individuals. I'm coming from an anthropology background. Nene a while ago is a doctor. Some of us are public health professionals. One is a medical practitioner. So this, this diversity of young people should be very well articulated in the roadmap and in how we move forward. And this means as well that there's also cross-cultural awareness and gender equality and gender perspective in the roadmap and in the NTD space. And with that said, there should be like the intersectionalities of not only us being young people, but the intersectionality of the issues relating to NTDs. For example, there's social stigma, there's this disappropriate and disproportionate, stigma to women and girls when they have NTDs. So this magnitude of inequalities should be very much looked forward with, not only for young people, but also for women and girls. So that's my take on it.
Yeah. Kwabena, what are your thoughts on this? Oh, Tony, maybe Tony is on. Oh, Kwabena, there you are.
Yeah, great. Yeah. So
what Jonas just said.
Yeah. To begin with, I would want to say I'm certainly not an NTD expert. I've lived with it. I've had friends who have been deformed by these NTDs, and I have also been misdiagnosed of NTDs for the better part of my childhood.
Wow.
I also leave the technicalities regarding the water and sanitation aspect of tackling the NTDs. I'll leave that to the experts, as Tony will put it. Yeah, but then I would want to say that, obviously, the role of the water, sanitation, and hygiene in combating these NTDs cannot be overemphasized. Globally, over 2.2 billion people lack access to proper water and sanitation services. And when these figures are put out there, it sounds far off, it sounds strange, but actually these are very close statistics that people that are around us are actually having to battle with some of these challenges. Yeah. As I did mention, I grew up in a household where we had no access to water or sanitation. I mean, you had to just squat on a large pit with some 2 slabs and then just do your thing. We had water from streams. So I did suffer from osteomyelitis. So though this cannot be classified as an NTD, but I believe these are all health-related issues that are connected to water and sanitation access. Since the launch of the SDGs, youth have been very, very instrumental in the access to and promoting the SDG Goal 6. So I think, and it's amazing to see that in this roadmap, much more effort has been given to the role of youth in combating these NTDs as compared to the previous roadmap that we had.
Yeah, great. Tony, what are your thoughts? Is there enough scope in this for youth development? It seems like Tony hasn't been able to join. He was having some problems earlier. Hopefully he can join us as we continue. So generally, are funding agencies and political leaders doing enough to support young people in this fight? So it's all well and good that it's on the, the roadmap. Perhaps we can, I don't know, Jono, you could start off on this.
Actually, Patricia, in all spaces, young people really had this lack of opportunities, specifically on funding and resources. That's what we really needed. And with universal health coverage, the centralization from national to local governments is actually happening and is implemented. No? The question is, how can we ensure that young people can be reached, especially those who are already at the forefronts, at the small units of the local government? So how can we ensure that donors and funding agencies, have the systematic framework and systematic process of really giving and pulling out funds for pushing funds for young people to mobilize community engagement.
Yeah. Tony, I see you there. And given that the movement you chair has worked alongside local governments and donors in the area of family planning, you must have some great insights into how things can work, or not?
Yes. Can you hear me?
We can. Just speak up a bit. We've got to hear your voice. Come on.
All right, thank you so much, and interesting conversations that are coming out there.
Yeah.
I just wanted to give out just the history of NTDs in Uganda.
Well, hang on a minute. The question was, how can funding agencies and political leaders do more to be able to support young people in this fight?
Yeah, first of all, we need to embrace public and private partnership, and to embrace that with the local leaders, they need to work with young people as partners, not as messengers, in terms of pushing for this agenda. Young people should be in the processes of designing the programs, in the processes of implementation, and also monitor, so that they can be guiding the local leaders on to pushing for this agenda. But however, there's an issue of funding that I think needs to be be taken note of.
Yes.
About it, because a lot of funding has actually brought these entities to be on a standstill. And for example, in Uganda, leprosy and lymphatic filariasis is an issue to most of this population, and most of these young people are also very poor. They don't have access to these health facilities, and remember that NTDs most of these diseases are infectious, and they're affecting populations that are coming from a poor background. So we need to address the issue of funding, and also I've seen in the roadmap it has a very clear strategy in terms of engaging young people. We have the youth to combat NTDs. That's the first one, the global one. So we need to make sure that we have them in these different countries with our local leaders, to make sure that young people are on the forefront of this agenda. Yeah.
Okay, so young people designing programs, making sure that the funding streams are there. Kwabena, what would you add?
Yeah, so to answer the question, I think from the water, sanitation and hygiene perspective, there's a lot more that could be done to improve the funding situation. Also, especially in Ghana, you go to some of these communities that are suffering from these NTDs, and you try to give them alternative livelihoods, and the intervention that they are used to is the administration of drugs and vaccines. So I remember we had a program. We tried to give waiters and to try to build the adaptive capacity of these local folks. And they told us, look, if you are not here with drugs and vaccines that is going to help us treat our NTDs, you better go back. That's what they've been used to. And I think it's time that we need to invest more funding into some of these youth organizations, especially in the water sector. And we need to invite the youth who are also involved in the water, sanitation, and hygiene in combating these health issues. We could have focal points, WASH focal points for some of these youth organizations that are engaged in WASH advocacy and the improvement, the achievement of the SDG 6. Yep.
Yeah. Okay. There's a lot of work to be done, and it all takes energy, resources. So I'm sure this is a question that everyone has asked and attempted to answer. Given the opportunity to reach out to political leaders and funders, what would your ask be from them? Kwabena, start off with this one. I know you work as a human resource coordinator of WASH. What would your big ask be?
Yeah, so first of all, I think we need to develop the capacity of youth. That's why the Water Youth Network, we've started with an initiative to develop the leadership development qualities in youth who are involved in water, sanitation, and hygiene. So I would ask the policymakers and our politicians and the decision makers to invest more into building the capacity of these young people. I mean, before this webinar, I tried to reach out to a couple of my colleagues asking, so what do you know about NTDs? And almost everybody that I asked, their reaction was the same, a look of complexity. And I asked, but you know about STDs, right? And yeah, everybody knows about STDs, but it seems nobody knows about NTDs. It's not for nothing that it's called neglected tropical diseases. So I think it's high time the politicians and the high-level decision makers paid much more attention. And I think youth are the drivers of change. With the use of social media, we can push up the education and then the knowledge of these entities among the youth. And I think the policymakers and the decision makers need to invest a lot more into building the capacity and the development qualities of the current youth.
Okay. So capacity building from Kwabena is the main one. Tony Muzira, what would your big ask be? One question, if you could just, craft it and ask the question, what would it be? Tony? He's there, but he can't hear me. Jonah, what would you say?
Thank you so much.
Oh, sorry. Here we are, Tony. What would your ask be? One clear-cut question.
My clear-cut question is to consider funding on entities to empower young people.
Funding to empower young people in NTDs, in the NTD community.
Yes.
Nice and clear. Jonah, what would you add?
My addition to this is how can we be inclusive and aware of the context of the people who are affected by neglected tropical diseases, and how can this inclusivity translate into ensuring funding for everyone who's affected, both patients and non-patients.
Fantastic. Nice, clear cut. We've got a question coming in here. Voices from the audience. How can we encourage governments, particularly the health sector, to institutionalize plans for youth involvement to NTD awareness and research? That's a big one. Who's going to tackle that? Jonah, you look so calm. I'm asking you questions and you reply with a question. What would you say to that?
Well, as always, the NTD advocacy is both clinical and political. One is really to invest in young people and young health professionals, young researchers, youth researchers, to maximize our capacities, because we know our communities very well. We're the experts of our communities. And what more if we have the funds to be the participatory researchers of our backgrounds and our capacities.
Yeah.
So yeah.
Okay.
Just to add to what she said, Jonah said, I mean, there's only so much that an individual can do. So I think I would re-echo what one of the panelists said earlier, to leverage the action of youth groups and networks, both locally and internationally. I mean, when we come together and we raise our voices, we could get the high-level decision makers to consider thoughts and our voices in combating these NTDs. Yeah, so thank you very much.
Tony, anything to add there?
Hello?
Yes, we can hear you, Tony, although your screen is moved. All we can see is your forehead.
Yes, can you hear me?
Yeah, but we can't see your face very well, Tony. Yes, and your beautiful smile too. Thank you. We can see you now. What would you add to that question there? Or to what your panelists have said?
Yeah, so my addition to that is we really need to come up with a clear strategy in terms of what young people need to do towards NTDs, and I think it's a very, very million-dollar question that we need to address.
Yeah.
But however, just like how we have the combating global network, I think we need to structure them in different countries, where we have Uganda, and we have leaders that are trying to engage young people to first of all interest them about NTDs. You know, you guys were showing us videos here, and one of the young person said doesn't know anything about NTDs.
Yeah.
So when we put up those country structures, we have each network in every country, and then we shall be able to be the ambassadors to interest young people to come on board, not just participating but pushing for this agenda.
Yeah. So you're talking about having like hubs in each country, and then you can all network.
Yes.
Yourselves. Brilliant. Okay. So in your personal opinion, what's the best way for organizations to connect with the youth? We had a similar question earlier for the second panel. Let's see what you have to say. Kwabena, would you like to start off with this? What in your personal opinion is the best way for organizations to connect with the youth?
Yeah, I would say that first of all, the youth need to be invited to the table. As I did mention earlier,
to be invited to the table.
Yeah. I mean, for instance, you could have, yeah.
Go and knock at it and say, hey.
You could have a youth focal point on every board, every organization that are combating or helping in the fight against these NTDs. I mean, this person will bring the perspective of youth into tackling these objectives. So I think having the voice, that youth voice, on every decision-making body that is involved in these NTDs could be one way to get to know what the youth are really passionate about, where their interest lies, and how we can align and refocus these interests and the goals that we seek to achieve in the battle against NTDs. Yeah, so I think we really need to get the youth on board in the decision-making process, so they can help us refocus and realign our strategies and our objectives.
Yeah. Tony? You heard the question?
Yes.
What's the best way for organizations to connect with the youth? You couldn't hear it? Jonah, I know you were nodding away when Kwabena was speaking.
I didn't hear the question.
Tony, the question is this. In your personal opinion, what's the best way for organizations to connect with the youth? Kwabena said, you know, I told Kwabena go and knock the door. But Tony, what would you say?
Yeah, I think that the best way is, one, I would actually agree with him that the issue of having young people on boards. You know, for example, if there is a board in WHO, we could have a youth representative on that board. And then secondly, you know, young people are the majority, so the best way to work with them is through networks. You know, that's why I was saying that if we structure them to country level, it's easier to bring more young people on board to interest them on NTD. NTDs have been there before, but it's a new thing to most of them. When you're talking about NTDs, some of them think they're NCDs, you know. So first of all, build networks, and then give them capacity. When you give them capacity, and then involve them in terms of implementing, pushing for the agenda, to hold their policymakers accountable.
Yeah.
You know, first of all, I remember when we were in Tanzania, and I was saying that during the launch of the Youth to Combat NTDs, and I told Dr. Mwele that I didn't know that in Uganda we even have an NTD control department under the Ministry of Health working with WHO. And she told me it exists. I was like, I don't know anything. So I think a lot of something needs to be done in terms of, you know, informing young people and empowering them about the NTDs, so that they can build good advocacy agendas in terms of making sure there's funding, you know, for NTDs in their countries, making sure they're also accessible. Because personally, as someone who is pushing for universal health coverage, remember that NTDs has a connection with UHC, because UHC we are looking at quality health care for everyone,
Yes,
without discriminating anyone. And NTDs, they affect the most poor populations. So you can see there's the connection between UHC and NTDs. So if we don't concentrate on NTDs and
getting the youth involved,
then we shall not be able to achieve universal health coverage. So
Okay.
the main point here is networks and making sure that young people are given capacity, the technical capacity, and also making sure that young people are represented from top to bottom. If there's a youth combat NTD in WHO, that would be my ask. That let's have a young person there, to push, because young people are very shrewd, and in most cases they're knowledgeable. They are
Yep, that's right, Tony. Let's hear what Jonah has to add to this as well. Jonah, you're smiling.
This is very short and sweet. I just want to really echo the work that the youth combating NTDs is doing right now. We have like 800 champions that will be coming on board, and the 13 advisory members we're doing all our best to really streamline communication and networking with all young people who wants to be involved in NTD's advocacy. So yeah, I'm very proud of everyone in the board.
Brilliant. Thank you so much. It can only mean great commitment and passion given all that has been shared today. I thank you all, and to all the panelists and the active audience who have been contributing questions as well, for the great work that you all do within the NTD community. Turning to the great selection of voices. Let's hear from Elundu Roland from Cameroon, who sent in a video message for us all.
Bon après-midi à tous. Je suis très content et très honoré d'être parmi vous aujourd'hui. Je m'appelle Elundu Roland. Je suis jeune défenseur des maladies tropicales négligées au Cameroun parce que elles affectent plusieurs millions de personnes dans mon pays avec des conséquences néfastes sur le développement des familles, des communautés et du pays dans son ensemble. Parmi elles, la schistosomiase et les helminthiases intestinales sont celles qui affectent le plus grand nombre de personnes avec des conséquences néfastes sur le plan sanitaire qui ne sont plus à démontrer. Je me suis proposé d'apporter ma modeste contribution dans la lutte contre ces MTN en proposant des solutions simples qui pourront être appliquées dans plusieurs pays endémiques. Ainsi, je suis persuadé que les jeunes ont un rôle très important à jouer dans la lutte contre les maladies tropicales négligées dans leur communauté. Ceci peut se faire au travers des innovations concernant à la fois la recherche opérationnelle, la recherche de mise en œuvre et la technologie. Ce potentiel que représentent les jeunes doit être exploité au maximum si nous voulons arriver à l'élimination des MTN à l'horizon 2030. Merci.
I like what Elundu said just there. It's all about optimizing the drive and energy of young people. No half measures, not just a seat at the table for optics. You go all in, like we heard across the board from our panelists today. And just having a moment to begin to let all the layers of rich information sink in. I feel some music would be perfect for that. So we're going to be crossing over to the vibrant city of Dakar, Senegal. I asked Fefsi Felix a question about what NTDs mean to him as an artist and how to use his talent to spread the word about them. Here's his response.
Lorsqu'on parle de maladies tropicales négligées, on parle de maladies qui touchent plus d'un individu sur cette planète. À mon sens, ces maladies ne sont pas négligeables et les individus qu'elles affectent ne doivent pas être laissés pour compte. Plus de 40% du fardeau de ces maladies affectent le continent africain et certaines, comme les vers intestinaux, affectent tout particulièrement les enfants en bas âge. Ce sont des maladies des inégalités et de la pauvreté. Alors, en tant qu'artiste et vidéographe qui a longuement travaillé auprès de Speak of Africa, j'ai été confronté aux ravages de ces maladies ainsi que du paludisme. En tant qu'auteur-compositeur, je pense qu'il est primordial pour moi de m'assurer que les jeunes de notre continent comprennent les fardeaux de ces maladies et s'en approprient leur lutte. Alors, elles nous concernent tous. Elles concernent notre présent, elles concernent aussi les générations futures. À travers mon art et mes chansons, écrire sur ces maladies, c'est les graver dans notre culture. Mais c'est surtout attirer l'attention sur elles en leur faisant traverser les frontières pour éveiller les consciences et aussi permettre d'y mettre un terme le plus rapidement possible.
so nice. Today, tonight, we feel so nice. Anytime, anyway. Oh, mama. Kaima wala Africa, don't be scared. Fimagak down your benela. Follow the melody, beauty, love and harmony. Daje bagini, smile and be happy. Où que tu puisses aller en Afrique, tu te sens comme chez toi. En Afrique, taloncho walerero. En Afrique, jamak salam la ñu moom. Fu ma jëm fu ne, lu mu sori sori sama taaru réew rek laay bëgg a wone. Te ba may gune ci laa xam ne jom ak njàmbaar fi laa Kudone Kufinyo dega delose Harit sama aksil Kaima boyala Degala Terala jegesil Ganek Senegal Wala Gambia Mali Guinée Niger Mauritania Côte d'Ivoire Cameroun Tanzania Love is everywhere in Africa. Today, tonight, we feel so nice. Anytime, anywhere, we feel so nice. Today, tonight, we feel so nice. Anytime, anywhere, we feel in Africa. We feel so nice. Come on, come on. In Africa, feel so nice. Come on, come on. So nice. L'amour est tout ce dont nous avons besoin. L'amour est tout ce dont nous avons besoin. So we can live together. Où que tu puisses aller en Afrique. Africa. Taluncho. Walerero. Today, tonight, we feel so nice. Anytime, anywhere, we feel so nice. Today, tonight, we feel so nice. Anytime, we feel so nice. Come on, come on. Feel so in Africa. So nice. Come on.
Felt like a rallying call. Thank you so much to Pepsi Felix for sending that in to us. And I think it's an opportune moment to invite Gerald Chirinda in, whom many of you, if not all of you, know, founder of Future Africa Forum and for Dynamic Youth Combating NTDs. Gerald truly is a thought leader who has been instrumental in making this webinar happen. So firstly, allow me to give my thanks to you, Gerald.
Thank you, Patricia. It's been such an exciting webinar. Thank you so much for having me.
I know it's been so eventful, this 1.5 hours already. It just doesn't seem, it just seems like it's flown by. You've been investing into what's been shared today. What are your first thoughts about it?
Well, I think for me, what's been really amazing, before we even get into, the panel itself, is just the words by Dr. Tedros, in his opening remarks. Hearing him say the words NTD-free generation for me was pretty incredible, because essentially this was our rallying call when we set up Youth Combating NTDs. So that, kind of moved me in a way, because sometimes when you're working as young people, you often ask yourselves, are people noticing? Are people catching the vision? So hearing him say that, was really encouraging. And really got me energized and excited.
Yeah. Okay, so let's go through the panels very quickly. I know you're probably watching the time just as much as I am, but that first panel as well, let's start there. What were your thoughts on that? What are your takeaways from that?
I think what I really loved about the first panel is the panelists sharing their personal stories, but coupled with the actions that they're taking. So very diverse people. I mean, you have an accountant, you have a scientist, you have Dame, who's Francophonie, you have Anglophone people, but all coming together for one reason, right? Which is to beat NTDs. And they're doing that in different ways, and different things are moving them. So for me, it really reaffirmed, the importance of diversity, the importance of always saying, hey, listen, it takes all of us to actually beat these diseases, right? And we are all coming from different backgrounds, but we have one goal in mind. So I think that first panel was just that reassurance that, hey, never look at whether someone is an expert or not, right? They have a part to play in beating NTDs.
Yeah. You're so right. And then, the second panel, there's a lot of this talk about being intentional, being open. What was your take on that, on the second panel?
Yeah, I think the second
Alison, Khair,
I really did love the remarks by all of them, and they've all taken different approaches, right, in terms of engaging young people. What I liked is they all recognize and see the importance of engaging young people. And I must say, as youth combating NTDs, we've been very, very fortunate, to get support from Uniting to Combat NTDs as we're building out this movement. And what I loved about it is the approach. I think approach is something that people take for granted, right?
They do.
So it wasn't a dialer youth approach like Togo said. It's literally, this is the challenge that we have. Let's sit down and actually have a conversation about how we can beat these together. And we are willing to partner with you, right? So it's a partnership. It's us working with an organization that is saying, hey, we recognize the ability, the talent, the innovativeness of young people, and we want to partner with you. How best can we do it? Then it got us into a conversation of this is how best to do it. I also love how the scouts in Bangladesh are doing it. I mean, I used to be a scout in my much younger days, in my youth. So I mean, one of the things that, scouts are known for is being responsible. And to see them plugged in within the NTD space for me was actually quite amazing and quite interesting to realize that this is a very old organization and institution, but still very much active when it comes to issues of public good. Canadian Network for Neglected Tropical Diseases. I mean, we saw Priscilla there, who was the ambassador for NTDs. I mean, that engagement is super important. I mean, she represented a lot of young people at Women Deliver event last year, talking about NTDs as a young person. And I think that is important. And every organization has a part to play in terms of just, engaging and connecting with young people.
Yeah. And with the final panel as well, with that ask, capacity building, funding to empower youth, inclusivity. What were your thoughts?
Yeah, I think it was fantastic.
And me asking Kwabena to knock on the door.
It was fantastic. Although I take a slightly contrarian view to knocking on the door nowadays, because we are here. This is a table.
Yes.
Right. I'm taking this as a table. And the what I would then say, I guess, to my peers and to other young people is let's actually use the tables that we get effectively and efficiently. Right. So let's engage. Let's push our agenda forward. I really loved, though, the aspect that this was a very diverse panel. Personal stories again. You're bringing in a young WASH expert. You're bringing in someone who is very cognizant of inclusivity when we're having conversations. And I really love this about Jonah. When we began engaging, her question was, where is gender in NTD?
In all of this.
That's where I work, right? So for me, that was like a aha moment. I also need to be able to reflect on this. And even what Tony said, the issue of empowerment is very important. The issue of local representation is very
Yes,
important,
yes,
and
yes, yes, yes.
that we are thinking about carefully, an issue that we are considering, because it's not an issue of you have a couple of special young people who are flying in from somewhere to come and represent.
To come in, yeah.
No.
Fly in and fly out.
And fly back. You see, ownership should be at a local level, right? It should be at a country level, be at a village level. But yes, it is equally important to engage regionally. It is equally important to engage internationally. So that's definitely something that I believe we're going to be looking into, and we have begun looking into, to say, how can we engage more effectively at a country level?
Okay, now Gerald, one question, one answer, just one sentence, okay? It's only fair to pose the last question to you too. Given the opportunity to reach out to political leaders and funding agencies, what would your ask be from them?
Well, yeah, political leaders. I mean, I've got a very long laundry basket, but I'll try and keep it, very brief. With political leaders, actions speak louder than words, right? So we have a lot of people who would say, yes, this is what we want to do, but they won't show it. So engage with young people, genuinely engage with young people and empower them locally. They are the solution to a lot of the challenges that you're facing in your communities, right? So talk to them, find out from them what solutions are you bringing to the table, and then provide them the platform and the tools to be able to, bring about change in their communities.
Thank you. Thank you very much, Gerald.
Oh, for funding, sorry, you had asked me a two-pronged.
Two-pronged.
Political and the funding. So for funding, the biggest ask, I guess, is fund NTDs, right? We have seen so much resources being poured into, COVID currently. And I mean, it's wonderful to see, but let us not forget that they are neglected tropical diseases, which continuously impact people. Children are failing to go to school, and let's also be able to measure, what matters to young people when you are giving them the financing. And I think the biggest one for me is for funders, carry out your funding with a youth lens, and that should be a key indicator when you are providing funding to organizations. How are young people being engaged within the NTD programs? Because when you fund these programs and you effectively engage young people, success is certain.
Yes, it certainly is, Gerald. Thank you so much for all your thoughts and your reflections and comments from the panel today. There are huge expectations for the young generation in NTDs, as well as the NTD community as a whole. The World Health Organization and the NTD department within it have taken that on board, responding to the challenges. So I'd now like to turn to the director of the Department of NTDs at the WHO to allow Dr. Mwele to share her thoughts on today. Dr. Mwele.
Hi, Patricia.
Hi.
I stopped my video. Can I get my video on, please?
Can we have Mwele's video on, please? We must see you, surely. There you are.
Thank you very much, Patricia, and thank you all for your energy and enthusiasm, and for all this effort in organizing and engaging in this fantastic webinar. Thank you for your power. Thank you for your passion. I would also like to take this opportunity to thank the Director General for his remarks and the commitment to youth. As Gerald mentioned, I'm sure it has inspired many of you to know that indeed we see you. And I'd also like to thank the artists who used the universal language of music to entertain us while we went through this very important webinar. When we wrote the NTD 2030 roadmap, which was the blueprint for NTDs for the next decade, we worked hard to ensure that it was consultative. We knew that for real and positive change to happen, we needed to be united behind one vision. But we did make a mistake when we did not engage young people as a constituency of their own. And we recognized this, and in March, when I traveled to Dar es Salaam to join the young representatives hailing from 13 countries for the high-level briefing and the launch of Youth to Combat NTDs, which is a youth-led initiative that seeks to empower, engage, and support young people in their efforts to combat NTDs, It was at this event that I was able to make a public commitment to rectify that error. And many of you who were there remember that moment when I sheepishly looked at you and said, no, we don't have you in the roadmap, but now we do. And I wholeheartedly, on my return, committed to including young people as partners and to ensure they would have a part in shaping our roadmap. So to close this event, which the young country representatives signed the Dar es Salaam Youth Declaration on Neglected Tropical Diseases, which was a commitment of their own to call upon leaders to strengthen political commitment, support youth-led movement, and increase domestic financing in order to combat NTDs and to reach the SDGs. So as we have heard today, they are also honoring their commitment. As we move forward, and as COVID-19 has shown us, the path to health for all and success in SDGs is going to be hard. We do not know what's around the corner, but we know that we need to stay strong and united as we continue to fight for social justice and equity.
Yeah.
It is my considered belief that a collaborative focus is necessary and essential if we are to take into consideration the next phase of our work and to sustain the gains that we have managed through the previous periods. This means bringing various aspects of our workflow together to form well-functioning integrated health systems that work for all populations in urban and rural areas alike. The task ahead is huge, but when I listen to the passion and drive of those we heard from today, and when I hear of their unwillingness to give and accept less than what they deserve, I feel nothing but hope and profound respect. Not only are we excited and happy to welcome you to the table, we are also looking to you to help us, guide us, lead us, and light the fire under us so you can be the generation that frees us from NTDs. I thank you.
Wow, wow. Thank you so much, Mwele, for that. The dialogue between the older and younger generation leads to healthier societies. So again, for keeping your words and continuing on your commitment to the youth with intent, thank you so much. Again, a huge thank you to everyone that has taken part in today's webinar for your views, your comments, and for joining us. Our next WHO webinar will be on how water, sanitation, and hygiene can help reach the 2030 targets. That's on the 19th of August. I hope you will join us all then. Right now, back to some more good tunes. Here's Barnaba from TZ. Enjoy, stay safe, and stay well. Bye-bye.
Hello everybody, come on your screen. Habari, bonjour. My name is Barnaba Boy Classic, one of the best in the vocals from Thailand, East Africa. I'll be performing live a song called Sorry. And I'm very happy to be engaged in the fight against NTDs. Enjoy yourself. This is the Boy Classic. Oh na nyuma nilitaka kuzungumza nawe ila nafasi yo kwako nikakosa. Sikujuta wala sikulalamika sababu na mimi kukupenda wewe. Japo nilisafa machozi nikangusha, hujawahi nifuta hata kwa kunyongopea. Baby ndo kwanza unacheka huku kinibeza na mashoga zako vibarazani. We mpenzi, dunia imebadilika, maana naweza nikakupa pesa na nikawa nakungopea. Basi vumilia, kesho nitapata, nitakupa kila unachohitaji sababu wewe ni wangu. Baby, I'm sorry. I'm sorry. to the beloved. This is when I was classic. One ninavyolia kama mtoto kwenye sekta ya mapenzi, nahisi nimechapwa viboko, na kinachoniumiza ni yangu huruma. Maana mama banabalini, si mwanamke akikuuza usije mpiga. Mimi ndo nasafa, huruma yangu inaniponza. Kazi yangu kufungua milango, si kwa maana ni wenzangu akigonga. Na kumpenda bado nampenda, na mvumilia kila kinitenda, na isiyo ndo nafasi anayotumia. Inshallah navumilia, najua taisha. Ipo siku atagundua kubwa mimi ni wake wama, na stamlipizia, nitamvumilia. Natambembeleza, tamsaisha kila atapojikwa. Sorry baby, baby, baby. Sorry my darling. Sorry baby, baby, baby. Sorry my darling. Baby, I'm sorry. I'm sorry. I'm sorry. I'm sorry.